Exhale. Okay, Walter, turn your head that way like you're looking at that hat. I'm gonna adjust this one right here, the 11 point. You get rid of this, turn your head that way. There you go, turn your head the other way. There you go, brother, you can still now. Don't try not to tense up when you breathe in, just try to relax. Breathe in. And exhale, you right? All right, turn your head for me. Yes, sir.
I've been doing this over around 7, 8 years now, maybe more. Maybe I don't get
All right, you ready?
I've been doing drugs like this. And it helps me with a lot of things. It calms my breathing, it calms my heart down, it keeps me relaxed, and it just makes me happy. I'm a happy person anyway, and with this, it makes me extra happy. Come on, put the pins in.
Thank you.
This helps me with my anger management because, Lily, let me talk. This helped me with my anger management, and I found out through taking anger management courses that it's not anger I feel, it's hurt. So it helps me manage the hurts that I have within, and keeps me off away from alcohol and substance.
Right, you don't have to medicate yourself anymore, this is your natural medicine, yeah.
Yes. Come on, hit me up, man. I'm ready
Yes,
for
sir,
something.
look up a little bit, there you go.
How long were you in the military?
Quite a few years. Quite a few battles.
I didn't really know the true history behind it, which was that one of the senior counselors, and I was telling them about acupuncture and stuff, and she came and she said, "Do you know how this really started?" And she was like, it was the Black Panthers and the Young Lords. They actually were the first ones to bring acupuncture to the South Bronx.
Growing up in the South Bronx, when the heroin epidemic really hit strong, I got used to seeing the addicts, the men nodding on the corners. And so I grew up with that sense. We just didn't drop out of the sky addicted to heroin. We became addicted to heroin because the situation and our environment exposed us to heroin. You can buy a bag of heroin for $3. So people got addicted to heroin, and then it just got out of control. At one point, there were 100,000 addicts in New York. So I wanted to do something. The need to go into the Panther Party came as I watched and observed the interaction of people, the interaction of party, and what the police was doing at the time. Even if the situation required a verbal interaction, verbal communication, they rather use the baton and use force. This I seen. I didn't have to read in the evening paper. I seen this. So I offered my skills in the martial arts located in the Bronx chapter of Boston Road. In the community, we structured the free lunch program. Also the daycare center.
The name of this revolutionary puppet show is called The Child, the Man, the Revolutionary, the Panther. Oink, 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 oink. Oink, 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 oink. Oink, 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 oink. Oink.
Yeah, this is a video about how the ear acupuncture got started at Lincoln. And as you can see, many of the themes are touch on those we talked about today. Folks who care about the people in their community, so they want to make sure that they're eating well, that they have access to health care, that they have a clean place to live and be. It reflects what happened on your campus in the past few days with folks that are upset, dealing with trauma on both sides of the fence. And how do you have a conversation about that in a way that does not devolve into social chaos? How do you do that? And it also speaks to the idea of young people. The folks who started this at Lincoln, I don't know if there was one over 30 years old. So these were young people. They did not know how have all the fiscal expertise to manage the money well enough. They certainly weren't the medical professionals, which is where White Lightning came in. The white progressive medical folks at the Lincoln Hospital that really supported them. And it was opposed every step of the way by the methadone, those that wanted to introduce methadone as a sole treatment without any other supports. And the community did not want that. Just replace one medication where folks are nodding out for another one where folks are nodding out. You know, so really wanted to avoid that. And that's also to say that there are, just to be clear, I've worked closely with pharmaceutical companies, participated in some of the first research using Prozac for panic attacks and all of that. So when you need good drugs, you need them. But the world is upside down. We reach for those things far too quickly, far too often, and we're not using these other modalities that have much less toxicity, much less danger associated with them without the risk of, quote, addiction, unless you want to call getting addicted to, you know, to Tai Chi a problem. You know what I'm saying? I don't think so. I call it my secret lover. I can't wait to go out in the middle of the night under the moon and stars and dance with Tai Chi. So the video is actually full length. It's about an hour and a half. You can pull it up on YouTube. I wish we had time to show the whole thing and talk about it, but I encourage you to really pull it up on YouTube and watch the entire documentary. I want to respect Dr. Ryan's time, so I've got about 10 minutes left if there's any questions or comments. Anything on anyone's mind they'd like to ask or comment on? I can come around with the mic. Okay.
I have a question about the exclusions for irregular acupuncture. You mentioned the unmanageable psychosis, mania, and delusions. Where do you draw the line between the exclusions and inclusions? You mentioned the patient with schizophrenia that had the command suicidal ideations. So where do you draw that line, and how do you manage that?
Yeah, I've set up programs on a number of inpatient settings. Well, the VA, as you know, is the largest healthcare system in the United States. For about 15 years, I worked in emergency psychiatry and inpatient with what is now Atrium Health in Charlotte, and set up programs on the inpatient unit there. So this is a general psychiatric inpatient unit where we draw the line. Imagine a person with dementia who really doesn't understand what you're saying. They're rambling, they can't sit still, they may be walking up to other people wanting to touch their needles. So really, if there's someone who cannot follow directions, for the schizophrenic patient with the suicidality, interestingly, there was an article published last year in March. There was a meta-analysis looking at how acupuncture helps to mitigate the risk factors for suicidality. Now that's the holy grail of mental health and psychiatry. How do we keep people from wanting to kill themselves? That's our version of a heart attack. And you can imagine from all the broad benefits, the social connectedness it can foster, the engagement and retention, that will help to mitigate those factors leading up to suicidality. So even a patient who is having thoughts about hurting themselves, there has never been a case where anybody say pulled a needle out of their ear and stuck somebody with it. I mentioned over lunch that in the 50 years that this has been around, there's never been one legal suit for an adverse treatment outcome. It's hard to find anything that is safer and less and more risk-free than this, especially with the ears. The ears are so important on the mental health side because in mental health, we really don't want to ask people to be taking their clothes off. We don't want to be, if they're in a group setting, how do you do all that efficiently if everybody's getting assessed for body points? And so it's a very efficient way to approach the issue too. And, yeah, thank you. Thank you.
Thank you for being here. So my question is more in the clinical trial sense in terms of research. So I have the opportunity to work in the oncology setting, and so one of the things that I'm kind of hoping to learn more from your experience as well as your understanding of the mechanism of action. I know I've done a couple of just literature review of the NADA protocol specifically, and there hasn't been much conversation about that. Can you kind of lead some insight in terms of what is the best first step moving forward, if that's something that I wanted to pursue?
Yeah, in terms of a research approach, the thing that holds most merit in my view is business as usual compared to business as usual plus the protocol. That way you don't have to, and make sure that in every other sense your population has been duly randomized so that you have the randomization method that's reliable. But the thing that will give you the greatest certainty, because there's a difference between a positive outcome and certainty. Certainty is when you've done, like Lincoln has, over 50 years, thousands and thousands of patients with the outcome. That's even better, quite frankly, than a randomized trial in a single setting with 15 to 20 people. So the thing that speaks most to certainty is business as usual compared to business as usual plus the protocol. Now, in terms of the mechanisms of action, what has been elaborated in traditional East Asian medicine in terms of Qi is just as precise as anything that can come out of a biochemical laboratory, because we're talking about is a dialectic, comparing one thing to another and gradually building a heuristic case for why something works. And heuristics is simply an explanation. There are lots of explanations. We know, for instance, that even with the antidepressants, the idea of a serotonin agent is just a heuristic device. All these medications affects multiple neurotransmitters, multiple symptoms. And so even to call something simply an antidepressant, when we know it also works for anxiety, you might use it for pain, you might use it for sleep. Most of what we prescribe on the psychiatric side has multiple sorts of uses, and you choose your heuristic device based on the explanatory goal that you have. So heuristics are great. If you Google my name, there's a number of publications that speak to the neurotransmitter aspect. There's one that I really like that's called Impulsivity and Stillness. and it looks at the DSM-5 psychotherapy and where the NADA protocol fits within that overall context. That was back in 2015. So I encourage you to look for that as well. But I'd also say, don't let any explanation stop you from using it. We do a lot of things and we don't understand why they work. You know what I mean? A whole lot of things. And many things that we use, similar to the idea that we were sold that antidepressants are enough to treat depression. That's not true. More than half of the folks we treat with antidepressants don't reach full, sustained periods of remission and wellness. So there's still a lot that is left on the table, even with the conventional approaches that we have within a mental health setting. We need something to help to augment it. So what I suggest that we stand on, I love standing on the knowledge of our ancestors.